Hello everyone, I'm Anastasia signing in from Noras. In this session, we will be dealing with the care of patient with dysphagia. So here, what do we mean by dysphagia? Dysphagia is a term used to refer difficulty in swallowing. It can either be neurogenic, myogenic, or due to obstructive problems. So as I have said that this is a term which refers to difficulty in swallowing. So as I have said that dysphagia is a term which refers to difficulty in swallowing. Here, if a person is having this difficulty in swallowing, then he or she will be having the symptoms of cough while eating, change in voice after eating, abnormal movements of the mouth, lips, and tongue. They will also be having an uncoordinated speech, incomplete oral clearing, regurgitation, drooling. These people, since they will not be able to swallow, they will be having difficulty in swallowing, and since there will also be an abnormal movement of the mouth, the lips, so here when they are eating, foods push out of the mouth, incomplete closure of the lips while they are chewing, as well as lack of chewing. So these are the symptoms that will be found in a patient with dysphagia. By having this condition, it can seriously compromise with the nutritional status of that particular individual, as well as on those people who are at a higher risk for aspiration of food. Here, since we have discussed about what dysphagia is, as well as what are the symptoms that can be found in people with dysphagia, now let us discuss about the care aspects. Here, as a nurse, it is very important that we must provide care to each and every patient. So here, if a patient with dysphagia comes to the hospital setting, the first thing that we must do is the nursing assessment. This nursing assessment needs to be done in patients with difficulty in swallowing or dysphagia in order to be able to identify what is the cause or what is the problem that they are having, which has led them to difficulty in swallowing, as well as in order to be able to refer that particular patient for further detailed assessment tests. By performing the nursing assessment for these type of patients, it also helps to decrease the incidence of aspiration pneumonia. While assessing, we also need to collect the history of the patient, and here we must find out if the patient has any history of the disease, has the history of stroke, history of use of any mechanical devices such as the nasogastric tube, the endotracheal tube, the myotube, or if he or she has done any post-endoscopy examination. We must also find out if the patient had undergone any surgery in the larynx, pharynx, esophagus, or the thyroid. We must also conduct the physical examination. We must assess whether the mouth is symmetrical or asymmetrical. We must assess if there is presence of any inflammation in the pharynx, if there is presence of candida in the oral cavity or in the mouth, as well as we must assess if there is presence of edema on the pharynx. So here, as a nurse, as I've told you, as soon as the patient comes with certain complaints, as soon as the patient says that he or she is having difficulty in swallowing, then you must first assess them, as well as you must collect their data. So after the data has been collected, after the physical examination has been performed, then as a nurse, you must review the patient's ability to swallow, as well as you must note down if there is presence of facial paralysis. As a nurse, you must also encourage as well as increase the effort of the patient to perform an effective ingestion, such as by helping the patient hold their head. Here, since a person will be complaining of difficulty in swallowing, this does not mean that you should not provide them any food, or you should tell them not to chew or swallow anything. But here, as a nurse, you must encourage them. You must try to help them increase their efforts in order for them to be able to perform the effective ingestion of food. Since they are having difficulty in swallowing, you can also advise them to be in a sitting or an upright position during and after eating. You can also stimulate the lips to open and close the mouth manually by pressing lightly on the lips or under the chin. You can also tap the deepest part of the cheeks using a scapula to know the weakness of the tongue. In order to encourage the patient to consume food that would help to improve their nutritional status, as a nurse, what you can do is you can provide small, frequent feeds at regular interval. While feeding, you must make sure that you do it in a quiet environment where their mind will be at peace. And also, you can provide semi-liquid food that would ease them while having, since they will be having difficulty in swallowing. So here, semi-liquid food can be provided. However, if the patient is having so much difficulty in swallowing, then soft foods can be provided to them. For these type of patients, as a nurse, you can also help them in choosing their foods. Here, you must tell them that they must choose the foods that are small, soft, that does not require to chew a lot, as well as that would promote easy swallowing. And if they are consuming any liquids such as water or juice, then you can also tell them to use a straw instead of directly drinking it from the glass. In serious cases where a person is not able to consume any food, then we can also provide temporary measures such as nasogastric tube feeding or parenteral nutrition, which can act as a remedy for the immediate problems. But if it is for a long term, the goals for rehabilitation must focus on helping the patient to recover the ability to swallow sufficient amount of food and drinks in order to ensure adequate nutrition. So, for patients with difficulty in swallowing, these are the interventions that we nurses can do. However, it is very important that this condition must be treated at the earliest, as we have come to know that because of this condition, it could lead to an inadequate nutritional intake of a person. It can lead to a reduced or to a lower nutritional status that could later on lead to many nutritional deficiency disorders. So, as a nurse, these are the few things that you can do for them. However, these patients must be referred as well as treated by the physician for the cause of dysphagia at the earliest. So once the physician has identified the main cause, further treatment can be followed, and as a nurse, it is our responsibility to perform any procedure or to administer any medications depending on the physician order. So now we have come to the end of this small topic, whereby in today's session we have discussed about what do we mean by dysphagia, what are the symptoms that we can find in a patient with dysphagia, as well as we have also discussed about the nursing assessment and intervention. So I hope you have got a clear understanding of this topic. I'll be meeting you in my next session. Until then, have a good day. Thank you.